So this is an ascending spirometer, and so what it does is it expands your lungs. And so we use this a lot of time with patients who have pneumonia or like short of breath or like COPD. It can help expand their lungs and get rid of the fluid. It's very preventative for that.
Or if they're just on like long-term bed rest, it can prevent pneumonia.
And so we'll set it to like a range, and so what they do is they breathe in to it, and then it'll go up. And then that's how they can tell if they're expanding their lungs enough. And typically we do it 10 times every hour, which it's really exhausting if you have a patient do it. It's one of those things where they're just like, oh, do I have to? But yeah, so we have just a few questions for you guys.
I had a question about that device.
Yeah.
Do you have to, someone might use that at home, you said?
Yeah.
So would they have to clean it every time, like every hour, or how often would you tell them that they had to clean it out?
Typically, if it gets dirty, I would say clean it, but I feel like, that's a good question. I mean,
Probably like every week, I would
yeah,
say.
just like
with
warm water.
soap.
But yeah, so they normally get this in the hospital and they get to take it home. And so we do encourage them to at least do it once a day when it's at home. When they're in the hospital and immobilized, you want them to do it every hour.
Great, thank you.
Yeah, of course.
Sorry, I didn't mean to derail that. I was curious.
Okay, so seeing the skit, does your perspective change on nursing at all? Like, is this like what you typically would see or typically think of nursing? Yes.
I didn't realize how much communication you have directly with the doctor. Would you be on the phone like in the patient's room, or would it be like
No.
Typically you would leave, unless it's like an emergency. You could be on the phone with when there's a patient there, like if you need like the rapid response team or something. But typically you would go out when you're like charting. There's like normally computers and you have a phone, and you would call the doctor there and be like, here's the situation, here's the background, my assessment, and then my recommendation. What would you, based off of what I gave you?
We use a tool called SBAR, and it's situation, background, assessment, and recommendation. So that's what we use for communication, so that we get all the information and like better
And I would
communication.
just add that it depends on the facility. Some facilities, they would call the doctor directly from the room because they're more patient-centered care.
Yes.
I guess, well, this goes along with kind of what, when we did our skit, how ours was more, we had to get lifestyle stuff from the patient, but with nursing, it seems like if you're the first person to see the patient, that the doctor would be relying on you for all the information until you get that, so you guys have to really...
Yeah, communication with doctors are really important. Since nurses are mainly by their side, the majority of the time we can see like what changes. The doctor will come in and like assess as well, but they'll take what we say to heart. And so if we see a change, like in say their blood pressure, we have to call the doctor and be like, hey, this just happened. Like, is there anything you want us to do? Like, a lot of times we see the front running stuff, so we have to contact the doctor if something severe would happen. Or just like, but yeah. So, you guys have any other questions? Okay, and then is there anything you were surprised about nursing with what you saw?
No, I would say that's pretty accurate. I had a clinical that was in an acute care setting, and there was multiple times that, for us, at least for PT, you would at least go find the nurse depending on what floor you're on, especially like ICU. You go check with nursing to make sure that they're okay for PT.
Yeah.
So, yeah, I think it's very beneficial that you guys are constantly in contact with the patient, because it's easier for me to go talk to you than it is sometimes to find it in the notes. And
Oh yeah, for sure, yeah.
I'm at an acute care hospital once a week right now, and we talk to nursing every time before we go into a room just to make sure and see if anything's changed. But nursing's like the profession.
And that's one thing, being at a clinical site, that's one thing that surprises me is like how in depth they are with their patients. Because I could like just get a patient and I could ask the doctor, or not the doctor, the nurse anything, and they would like be like, oh yeah, they had this medication. They're going to like dialysis today. Like they know it's like insane how much they know.
Like their normals for like for vital signs too,
Yeah.
even if
Wow.
they've had the patient for 24 hours.
Yeah, it's insane. Yeah.
Sorry, I just
No,
had
you're
a
fine.
question. Is it common for nurses to maybe carry around their own notebook to keep track of their
Mhm.
specific patients?
Yes.
Well, you can't keep like patient, like the name or date of birth on the paper, but you can like take notes.
Yeah, or like
with it.
room number.
But we have like computers with charts, so if you need to know something, you can just easily access the chart.
But like, yeah, what I do is I carry around a little like notebook paper and like we'll write anything like vital signs because it's hard to like
Yeah.
stay in there talking to your patient and remember those vital
Right,
signs.
and then communicating
Mhm.
with other professionals, I guess, in the hospital. I was just wondering how you would keep track of that. And like just getting it quickly.
Yeah, so basically if something would happen that like I noticed that she needs nutrition advice or like say I had a heart attack, I'd be like, okay, I'm gonna talk to the nutrition. So I'd have like, especially in like a hospital setting, I'd call up the dietitian and be like, hey, this person needs advice on that. Or like, same for like, if somebody would say, we oftentimes call social work because a lot of times people won't take their medications because they can't afford it. So that's where we go, okay, we're gonna call social work to help you with that, to make sure that you are taking your medication, that kind of thing. So we do work with a lot of people, pretty much everybody. So it's kind of interesting for us, but
I would just add that piece of paper you're talking about, we call it the brain. And so, because it really is the
Yeah.
brain, if there's a crisis going on with that patient, if they start to code, you need to pull your brain out because you're gonna have 10 nurses running to help you plus everybody else. And they're gonna wanna know what's going on and you're gonna have to very quickly spit that out.
Yeah, it's like a sheet and it says like why they're admitted, like their vital signs, like a couple sets of vital signs that has like every assessment, like cardiac, neuro,
muscular.
GI,
Yeah.
like everything. So. But they're just quick.
Snapshots of every patient. That's been wonderful. I might have to steal a couple.
Good. All right, thank you.